Hi, everyone. A very warm welcome. Welcome to Connecting the Dots. Connecting the Dots is a weekly Facebook Live talk show hosted by aphasiasg. This show aims to answer all your burning questions about our healthcare system and services within the system, such as speech therapy, music therapy, social work, and a little prelude for today, physiotherapy and occupational therapy. So, as well as any of the questions that you might have about brain injury and aphasia. We're basically here to help you connect the dots. I'm Melinda. I'm a speech therapist and volunteer for Aphasia SG, and I will be your host and moderator for tonight. Each week, our show will feature different healthcare professionals, patients, or caregivers who will share their insights and their experience. For our episode today, we'll be joined by two special guests, a physiotherapist and an occupational therapist who will share their story and experiences working with people with disabilities and aphasia. Now, to our viewers on Facebook, we encourage you to ask questions and leave comments freely throughout the session. Our guests will aim to address any of the questions that you have before the end of the show. So without further ado, I'm pleased to introduce our guests for this evening, Yijun and Dorene. Welcome.
Hi.
Hello.
Hello.
Hi. So
Hi.
thanks so much, Yijun and Dorene, for joining us this evening. Shall we start off with a quick introduction of yourselves and what you do? Shall we start with Doreen?
Okay, sure. Hello, everyone. Okay, so I'm Doreen. Yeah, so I have been working as an OT in the hospital for about 9 years. Then started from last year, so I stepped into community and now mostly doing home therapy. Yeah, so I specialize in neuro rehab. So have been working with a lot of like clients with like stroke, dementia, brain injury, and others. I like to laugh. So I really love to see patients enjoy the therapy session. So I believe that laughter actually is the best medicine. Got people ask me, you are so short. So actually, how can you see? Okay, sorry. So how can you see patients actually who are actually much taller than you? I would say that probably it's about problem solve and the skills. Like for example, this is one of the picture when I actually doing home therapy. Okay, thank you. Yeah,
Thanks so much. And thanks for joining us on the show.
yeah.
And now over to Yijun. Maybe tell us a little bit about yourself and what do you do?
Hi everyone. So I'm a physio. I have worked my entire life in a government hospital. So I've been in the same place for 15 years. Um, I look after a range of patients from after surgery, before surgery, to until they're home and they come back to us from the community. At the moment, I specialize my interest and I work mostly in oncology wards.
Mm.
But I'm part of a team, so we cover a wide range at the moment. Mm.
And so I also understand that you are a mother of three lovely children.
That's my real
So
job.
yes, so I hear that that's your real job.
Yeah.
And physiotherapy is just a sideline.
Yeah.
Nice. Okay, so thanks so much for taking time away from your real job and your family and coming to join us today on the program. So I think I guess a lot of people would probably have this question, right? So as a physiotherapist and as an occupational therapist, what do you do and like what would a typical day look like for you? So shall we start with Ichin this time since we started with Doreen previously?
Okay, so because I cover mostly inpatients at the moment, we will
Mhm.
always have a list of patients across the different wards in the morning. We
Yeah.
need to prioritize the ones that need to be seen first for medical reasons or for reasons if they're going home early. I also cover outpatient classes. So a lot of our patients who are old, who physically having problems at home, they do come back to us and we follow up with them over a period of few months if they need to. And
Yeah.
we also do a lot of preventative therapy nowadays. So there's a lot of emphasis and encouragement for patients to come in and optimize their health. So you try to get fitter and healthier before surgery or before medical interventions like chemotherapy. So the evidence is very strong. It's not just about recovering from an episode of poor health. It's about optimizing them and sustaining that pattern for a long time. So
Yeah.
that's we do a lot at the moment. Yeah.
Yeah, that sounds really important, because I'm sure you don't want your patients to be staying in the ward for too long. So what it sounds like is that if you can optimize their baseline, or like what they were like even before coming in, then the hope is that when they come in for any, surgery, like or treatment, like you mentioned, then hopefully they'll be able to start off on a better foot.
Yes.
Would,
So
would that be correct? Yeah.
yes. So we always say you come to us for 2 weeks or a month. You go home and you are managing your own health for the next 1 year or 2 years. So we always feel that preparing themselves to manage themselves better, there's always better health outcomes at the end of it versus just getting intervention or therapy during your stay.
Yeah. So that's really interesting, and I think it's quite. I mean, maybe it's a new concept to people who have not come into contact with the healthcare system. Good for them, right? But I think it's a new concept that maybe all of us need to start thinking about as well. Cool. So and Doreen, what would a typical day look like? Be like for you as an OT?
Okay, so because now I mostly do home therapy, so I think my typical day will be like travel around Singapore.
Wow,
So because
环岛追追追。
I think it's really a lot of time on the Grab, on the taxi. Okay, so because I stay at Woodlands, sometimes my client can be at East Coast, sometimes Jurong East. Okay, so basically it really depends on where they stay. Yeah, so most of the time, actually, home therapy is like usually for the first time, I will provide the assessment. Yeah, so it's like at their home environment. So take a look at the home environment and ask a lot of questions about what is their routine, it's like or their schedule. Because I realized some of the patients actually when they discharge home, basically it's like at the home and when they discharge home, because in the hospital, actually they have a schedule or the routine and there's an intensive therapy sessions. But when go home, a lot of them actually don't know what to do, or especially with like person with like aphasia, if can't really communicate well. Yeah, so basically I help them to plan the schedule.
Yep.
Yeah, so conduct the session, teach them what are the activities actually they can do at home. Yeah, so how to engage the clients. Yeah, so engage them in meaningful activities and functional tasks. Yeah, so
Yep.
sometimes, because in the hospital we have like maybe it's like a lot of equipments. So at the home environment, I will try to just see, I will just tell them, okay, just show me whatever you have at home. So for example, even very simple things like clothes pegs. Yeah, so we
Yep.
can do some shoulder, ranging exercise, reaching exercise.
Yep.
Or like my dementia patients love to play ping pong. So we will just have like this game. Yeah, so it's not only limited to the home environment. So sometimes I will bring them to the park or even to the coffee shop. Yeah, so for some exercise or the rehabilitation or like the cognitive training or the endurance training. Yeah, so I think the main goal is really to engage them in the things that which they like and which is meaningful to them and maximize their quality of life.
Yeah.
Yeah.
So I was actually really intrigued by this photo of the man doing the clothes peg. So that's very interesting, because like I never thought that something as simple as a clothes peg could be used in therapy. Like it looks like it's not just one clothes peg, right? It's like two rows of clothes peg. So it seems like wow, effort to
Yeah. So
yeah.
it's also quite funny. Sometimes I will also ask them, okay, so you have kids at home, right? Whatever toys or you have, or in the kitchen or whatever things
Yeah.
you have, just
Yeah.
show me. Yeah, so you don't need to buy a lot of expensive things. Because also a lot of patients they buy a lot of expensive things at home, but they don't know what to do. Yeah, so I think this is the things that I like lah. Discuss with
Yeah.
patients, we try to be creative. Yeah.
Yeah, and that is super creative, I must say, making use of everyday objects to, achieve your therapy goals. That's awesome. Yeah.
Yeah.
Okay. So I guess I mean, like looking at, listening to what you have shared with us and like looking at the photos, right? I must say lah, I wonder, do people think that OTs only just like what you say lah, just mess around with the things at home? Is that like a misconception that people will have about what an OT will do?
Yes, I think this is very common. If not, they will say, okay, so OT, occupational therapies, okay, so we do hand exercise. So it's just like upper body belong to OT, so the leg belong to physio. But then I will tell them,
Yeah.
definitely we work well together with a physio or with the ST. So because we work as a team, we cannot just separate. Like I need to see that how you walk into the toilet. I cannot say, okay, so because I'm not physio, I cannot let you walk. Yeah, so it's like I think we have to combine everything. Yeah,
Yeah.
and I think also like they will say, okay, occupation. So is it like, but I have some patients ask me, but I don't have jobs. I don't need to work. Why do I need to see you? Or maybe it's like, oh, okay, so actually then you are helping me to look for a job. Yeah. So actually it's like not only like that. So
Yeah.
basically we really have to see is that occupation can mean that actually activities or some things which is meaningful to the patient. Yeah. So basically we have to, discuss with them, like check actually what is the goal. So goal setting is very important. So we work towards that. Yeah, so I think for example, this picture is like we also do community outing. Yeah, sometimes especially after discharge from hospital, because their mobility like limitations, so most of the time actually they stay at home. But
Yeah.
to patients and to carer, quality of life is very important. Yeah, so this one actually we plan an outing. So indeed we have the therapy session at Changi Airport. Yeah, but
Wow.
definitely before I plan the outing, before I brought them out, actually I need to go there first to do the assessment, environment assessment of like Changi Airport area. So I need to find and search for a area which is like a bit like quiet. Yeah, and so that's why patients I won't be too distracted by too much actually stimulation. Yeah.
Okay.
Yeah.
Wow. So yeah, lah, I'm sure like this quote, right? Wow, occupation means help me look for a job. Do you ever have people coming to you and handing you a resume? Nah, OT, help me find a job.
Maybe I will refer to I don't know social work. Yeah, but if they
Yeah.
have a job, definitely one of our role is
Yeah.
we also do the job analysis and the task
Yeah.
analysis. For
Yeah.
example, after the stroke, they have some impairment. Yeah, so then we have to see how to help them to maximize their function or communicate with the employer, help them to return to job. Because
Yeah.
to them, job is their occupation. It's a
Yes.
meaningful occupation.
Yes.
Yeah.
Yes.
Mm.
Yeah. So
Mm.
it's just that I'm just gonna show this
Oh,
slide because I think like OTs do more than you think. Okay,
okay.
guys, it's not just about finding you a job.
Yeah.
Okay. What
So
Doreen is saying is that there's more
yeah.
to life than work. More to life than work.
Yeah. So I think this picture is about like home environment assessment and also a car transfer. Yeah.
Yeah.
So this one is really very meaningful because this client actually after discharge there, whenever he goes out, actually his only outing place is a hospital medical appointment.
Oh,
So and he need to be
ayo.
there by ambulance only. So it's very sad because he already, has like aphasia, already can't really communicate much and tell us how he feels. Yeah, so but you can actually observe through the expression. Yeah, so after some period of time of the rehabilitation, after that I suggest why not we try car transfer. I think I have confidence in you that you can do it now with the caregiver training to the carers. Yeah,
Yeah.
so after few more practice, actually really can. Now he really don't need
Yay.
ambulance. And sometimes
That's
I joke with
awesome.
him. I say, I help you to save a lot of money, yeah.
Yeah.
Because Grab is much cheaper
Ambulance.
than taking
Ambulance
ambulance.
very expensive.
Yes, and he
Yeah.
can go out now, it's like family member can bring him out easily to go out for makan, yeah,
Yeah.
go shopping. Yeah, it's
Yeah.
really quality of life.
Yeah, that's great.
Thank
And
you.
so and so what about Yijun? Are all physios fitness buffs? Like got
No,
six pack? No.
no. Maybe the whole world.
No. No six pack. Ayah.
One big one.
This one is United Nations. So what are the common misconceptions? To me, right, physios are damn fit, super fit.
Yeah.
Yeah.
People think that we do a lot of massage for pain.
Ooh.
Yes, in outpatients, a lot of back pain, neck pain, which is very common. So they
Yeah.
come to you with pain, and the truth is, a lot of people are very educated about what their condition is and they read up on it. So it's great because people are more involved in knowing what are options and how to self-manage it. But it also means that when they have expectations of how it should be managed, which may not be the right time or the right therapy for them, there's a lot of education. So I think there's a misconception. People, when we nag at people, so my patients that have known me for months always say, wow, you're very good at nagging, how you stay married for so long. They say, why you nyam all the time, all the same thing. I said, keep repeating the important things, right? I said,
Yeah.
pain is one big thing about how to best manage it. And sometimes the absence of pain is not always the ultimate goal of therapy. Of course, we want everyone to be comfortable, but as with a lot of things, sometimes there's time, there's also pacing, and then there's a lot of education to going to reaching a goal which we both the patient and the therapist or the medical team can agree upon, which takes up a lot of time. So misconception sometimes comes from why do we talk so much about certain things and why is it important that we keep emphasizing on certain things. So a good example will be people always think physios are fit or we walk patients up and down the ward, right? If you see the physios in inpatients in a hospital, it's
Yes.
always walking patients, sitting the patient out of bed.
Yes.
Stroke, that's all we do. We rock up, we move the hands, we move the legs. So we move hands and legs with the OT. So we do it together. We often push together, come back. So, and then STs are not just mouth. We'll talk to the ST. Hey, we eat out, then you eat after you feed the patient after that. So everything is timed as a team.
Yes.
So yeah, but a lot of things about sometimes patients understand we don't walk for fun. Yes, we walk, but we will also have our reasons for saying, okay, let's walk a little bit more because I think you can. Versus certain patients where we look at the heart rate or what the patient's response is or the medical condition. Why do we choose to do sitting tasks versus standing versus walking versus some patients we keep trying to push them to do a little bit more. That's the background work that people might not understand sometimes. So it looks like a very simple thing. Hard tasks that we are very driven to do will be like what Doreen has said, when the task is very difficult at a very difficult time for patients like our new strokes or very young strokes, or patients who come in with really bad medical events. There's always a time at the beginning where it's a lot of supportive intervention where, let's pace ourselves a little bit. Let's have a look at how long this is going to be. So I guess it's a very good continuum from where we are to where Doreen is, because I think a very hard thing which people don't talk about is how long therapy really takes, how long the body sometimes takes to recover. And even though, everybody's third auntie will tell you, you 做这个啊, you do this, in 2 weeks, I guarantee you're better. Sometimes all these well-meaning advice stress people out. They will ask you, like what Doreen say, I buy this, I eat this, well, I mean, it's great that people are supportive. When I guess the thing is we love all these things because then we can address it when we're in a hospital. We set the tone and we say, okay, we can try this has worked with some people, it hasn't worked with certain people. At the end of the day, I guess the biggest misconception is sometimes patient or therapists unfortunately may not agree on certain things. And I feel rapport is very important. Like what Doreen said, you can laugh with certain patients, you could be really serious with certain patients, but it's really important to work with somebody you trust, because that's really important, that you believe that everybody wants the best for you. And I feel that that's a very important thing that we may not talk about it very much in terms of let's work on this together. But fundamentally, it's a very important relationship, I guess, for a therapist and a patient.
Yeah. So it's a lot of sort of collaborative kind of goal setting where everybody sits down, gets on the same page, and we make sure we set kind of realistic,
And we encourage
achievable.
Talk about it, especially what Doreen said, people who may not be able to speak very much or feel that they don't want to say so much. I always feel it's very important to say what's important to you, or I have patients who say, I just don't want to do this today, and it gives us insight to what the patient's going through. Maybe it's just too much. And we have had patients who say that they will say, well, in Chinese, like, they will say, physio, I really don't want today. Today, I really can't, and we said, okay, let's go for sunshine. We sit in a wheelchair and we go somewhere. And then OT lah, we'll push them level
Thai therapy.
up or something. Then we come back. Then everybody like,
Yeah.
there's that thing of we're all humans. There are days where
Yeah.
we're better, we're all motivated. Certain
Yeah.
days we just don't want to do anything, and it's fine.
Yeah, for sure. And it's like respecting the client or the patient's boundaries, because at the end of the day, they have a right to choose, and who are we to impose what we think is right onto another person. Yeah, so absolutely right, and I completely feel where you're coming from. So I'll just touch a little bit about what you mentioned in terms of like motivation, right? Everybody has different motivations. So what then motivates you to continue, with the work that you do? Maybe Yijun, like what motivates you to do the work you do?
I must say, I'm very good bosses. I've said that. Yes. I mean, 15 years is a long time. It's longer than my marriage, So I wait till my boss. My are physios, and even my main boss is a physio. And when I was very young, when I just first started, I didn't know anything, and I used to ask her, my gosh, you've worked for so long. And she said, stayed with me for so long. Even now, it's our turn to mentor the juniors. And she's always said, you could be good at something because intellectually you get it. You're book smart. But she said at some point of your career, the reason why you do certain things and what pushes you, it might be a calling or but if you believe in your work, I guess. I don't know if that's the best definition for calling, but I believe when we believe in what we want to do more than anything else, there's a certain amount of, is that the best I could have done? Because it's a smart place to be. Nobody's physio for fun. I mean, maybe some people do. In the hospital, it's never a happy, it's always a difficult time. And as with everything, there's advances in technology, therapies, and so I guess rocking up to work for that is a big thing, because you're essentially working with another human. It's you, whatever we do have implications. How good we are has direct implication of, to a certain extent, obviously. Not everything depends on us, but to a certain extent, there's always a, could I have done better for this person? And not because we're wonderful people, but I think it comes with a job. Like you see it, and then you see, are they walking better? Is the tolerance really better? Or for patients who are really not ever going to get better for whatever reason, or patients towards the end of their life, being wise about what is essential for them and what's helpful for them. I think it's a great learning curve. Really. I feel that 5 year, 10 year, 15 mark, how I view it is very different.
Wow, thanks. I mean, it's always great to hear what motivates a person to stay in healthcare, because healthcare is actually a really, really stressful environment. Be it, I mean, no matter where you live, right? In Singapore, did you say that? True. But I guess it's also like what you shared in terms of like, you don't just see your patient as a patient. Like, you can't just, sometimes the relationship gets built and you build that rapport such that it's not just a patient anymore. It's like, you bring some of their troubles home with you, you bring some of their worries home with you, and so sometimes it feels like it's a bit beyond just a job.
It is.
Yeah.
And I think the ecosystem in healthcare is a bit different as well. I'm not sure if everything is the same, but I mean, we've all worked in healthcare. I do feel like the kind of draw for healthcare that want to do healthcare and in it for a long, long time, I think there's certain beauty in it. I'm not making it sound better than it is, but at least the relationship that I have with my team for a while, or with my bosses over a long time, that I honestly have great respect for people who do it, not because it's easy or you see certain returns in your career to stick into it, but you see it's very honest what drives them to be better. Programs that are difficult to start, that are difficult to sustain because of manpower, or are not glamorous things to do. It's just really, you see people working until 7, or my social worker colleagues they are calling families at 7:38. You know, nobody sees that. But you know, forever funding for families, which nobody really sees sometimes. But you see, just go, oh my gosh, everybody has families, but they're calling out to try to find something or arrange transport for one person, but do that. And I feel that's just amazing when you work with people like that, because then you think, oh my gosh, 为什么你的人这样好? I see my colleagues, I'm like, it's 8 o'clock, my gosh, your Grab is going to be so expensive. I see all these other little things that people do where their roles are not so obvious. It's not like they're great, it gets published. These things don't get seen most of the time. But
so it's all the unsung heroes that,
really people that are really trying very hard, honestly. So if you ask me what motivates me, is because all these people are around me and I'm like, okay, I need to go home now.
Oh no, me too. Oh, I feel you. So what about Doreen? I mean, if you are you're working on your own, right? So what then motivates you? Because if for Yijun it's like, the people who surround her that motivate her. What about you? What motivates you in your job?
I think okay, so I think motivation is really important. So I think what motivates me is when I'm trying to help patients actually to find their motivation. So I think motivation is very important because during the rehabilitation process, we need clients to have active participation. So we have a lot of clients actually also, I will say that I will explain to the family member, no one will have good mood after, their stroke or their disability. So I think this is the first thing we need to acknowledge that. So slowly, and then we see how to help them actually find the things which is meaningful to them and find the motivation, because this is very important. So, and when they improve, they are happy, I am happy. And so it's like, simple, they are happy and I'm happy. And I really love to see the interaction actually with the client and their family member. So for example, I think as well you see in the pictures, like, so father actually has cognitive impairment. So don't really know that actually how to interact with the kid, but he really keen to interact with the kid. So during my session, I will try to arrange a session. The goal is like for upper limb exercise, endurance training, cognitive training, but I will try to engage the son. So it's really a very happy session for both of them. So and for example, another picture, like this patient is my Amma is my patient. So with like aphasia, so expressive aphasia. So Akong actually is like dementia, both of them about 80 plus. So during the session, I always try to, let both of them actually play activities together. I even then encourage Amma to really talk. It's really very, very sweet to actually, it's like finally when she talk, I love you to the husband. The dementia husband sometimes remember her, sometimes don't remember her. So when the moment that actually, she taught this sentence, and Akong can remember her, the moment is really sweet. So I think I like to see all this, it's like clients happy face, even though you are sick, even though you can't really express, but it's like it's very important that you have a good mood and the motivation to keep going. So I think this is where my motivation comes from.
That's fantastic. It's such a lovely story to hear how a person with aphasia, when they finally can get the words out, that connection is cliche but priceless, right? It's really, really priceless. Wow, fantastic. So your patients motivate you, definitely. That's what I'm hearing. And so so we've got some questions coming in from Facebook. I'll just have a look. This one's quite interesting. How would you explain your profession to an elderly patient? Okay, Doreen, we start with you first. This one,
I don't want to say maybe you answer first.
I got no job, I got no job. Why I need an occupational therapist?
Usually I would say we need to do assessment first. So sometimes I will actually kind of like I definitely will explain first. It's like typical explanation about what's OT. Like we help to see whether you can do this, you can do that. We see what are the things that you like to do. Yeah. Then usually after that, then I will try to make sure patients actually understand what I do. So I will throw back the questions to them. Yeah. So it's like, okay, so that it's like now why I'm here, blah blah. Okay. So can you share with me what are the things that you would like to do and you would like me to help you? Yeah, so we set the goal, then we work towards the goal. Like for example, you want to be
Quite
able
smart, quite
to,
smart.
go to salon after you discharge to hospital. Yeah, so because I already have a client 90 years old, every Friday she will go to salon though.
Oh,
Yeah,
like wash hair.
she really will go to salon. Yeah,
Oh my
so it's like, oh,
goodness.
this is your goal. Okay, so
Old school.
then after that, okay, so this is what are the things that we need to improve on. Yeah,
Mm,
so I think this is
okay.
usually I will try to explain to them in this way. But I will
That's
ask them,
good.
actually, I will throw back the question to them to make sure they understand my role. Yeah.
Fantastic. I'm going to use that. I am going to use that to make sure my patients understand what I do.
Yeah.
Okay.
Yeah.
And Yijun, what about you? How would you explain to an elderly patient what you do?
Actually, it depends on why they're seeing me. So if
Mm.
somebody who's falling down a lot, I would say, Auntie, I need to know, Auntie or Uncle, let's find out what you're falling over for. What
Yep.
was causing you to fall over, and then
Yep.
see how we can stop you falling over, and then to
Mhm.
explain why it's important they don't fall. Some people
Yep.
think it's okay.
Mm,
It's post-surgery is quite obvious normally.
Yes.
If wound, we need
Yes.
to get you comfortable, and I'm going to teach you ways to get out. So it's most helpful, and it's more comfortable and safer for you. Um,
Mm.
People who are weak is usually quite self-explanatory, because usually I ask them, "Well, I'm the physio. The doctor has asked me to see you. Do you know why they might want me to see you?" Usually they will tell me, "Oh, is it because I fall down a lot of times?" Or they'll tell me, "Oh, maybe because I cannot walk so much," or "I have
Mm.
chest pain because I just had surgery or something," or
Yep.
So usually they have an idea of why they need to see a physio. So
Mm.
usually we will go with what they think it is, and then to explain
Yep.
a bit more. If they don't
Yep.
think they need to see me, which is sometimes, I don't know why the doctor asked you to see me. I'm very good. I said, okay, then you show me
Show
how
me.
good you
Show
are.
me.
Then I'll tell them, you walk from here to there. Usually they don't have obvious problems, like maybe it could be heart having a problem. So they feel okay, because they have been having
Mm.
heart chest pain for a long time. I said,
Mm.
okay, so let's see what this pain is like. Let's have a look at your heart rate. People usually like to know about their health condition.
Yes.
Usually I'll say, Auntie, do you know what a normal heart rate is? Is yours normal or not? They say, I don't know. Is normal or not? I said, not normal. So they learn as well. I think regardless of age, like what Doreen said, even when they're 18, 90, they all have an idea of what they feel like, what they want to do,
Yes.
what problems they have. Sometimes they know it. They may not be able to say it in a professional way, but they'll tell you, Jin Chuan, or
Mm.
jalan sikit-sikit na tak boleh tahan, they can tell you. They know
Mm.
in daily life what it translates into. And it's a bit like, oh, 你心脏不好啦, or, jantung tak kuat, the heart not so strong. Then you can explain to them, and they appreciate that. They will know, oh, okay. Usually, I agree exactly what Doreen say. They know what they want to do, and they kind of know what problem they have anyway. Seldom do we see people who are completely oblivious. Very, very seldom.
Mm. Mm. So then what do you do if, let's say, people don't want to see you? Even if you tell them they have a problem, like,
My
your
cut is, well, you don't want to see me, that's okay. Your doctor will see you. And your doctor feels you're not safe, you can't go home, right? People who don't want to see us sometimes, honestly, sometimes if they really have no problem, I take them at that way. If I see them walking well, I won't see them. But sometimes patients who are avoiding, so they know they're not well.
yes.
Or if they live alone, or if they're false, they will say, I don't want to see you, I can manage. So I said, okay, there is always managing at your baseline versus managing at a better level. So let's say if they live alone, I know you have been managed, and we respect their privacy. I mean, I've been to patients' home where they live in rental flats, and they have been managing. You don't know how they manage, but they have managed. So when the social worker visits, and then she tells, they have bed bugs, they are so weak that they cannot wash their clothes, but they manage, in their way they manage. And respectfully, we're not there to tell them what's the best way to do things, but we can say, Uncle, 有一点点肮脏, a little bit dirty. Let's get you help. If you don't want it, you can choose it, but why don't you try it? Or we can get meals to you. Why don't you try it? Or I really think you You don't want to use the wheelchair, it's fine, but let's get it sorted in case you want to, so that you can be independent. Everybody wants to be independent.
Yeah.
You know?
So it's still giving them that option, that choice of, yes, while there may be some difficulties or there may be some issues, but giving them that option of, do you want, this, or do you want that? Like whether you want to accept, a different way of doing things, or whether you're still more comfortable with your own way of doing things.
And I think Doreen brought up something, when people go through a bad adverse event, it's very hard. And sometimes we don't give them that time to grieve over it. It's all about, okay, you've been diagnosed with this, let's move on and get you better, But sometimes the loss is really acute. It's really difficult when patients ask you, how long can I walk? Can I walk? Can I get back to normal? Can I go back to my work because I have to feed my children? If I have chemo on Monday, can I work on Tuesday, Wednesday, Thursday, and chemo Friday? You hear things like that, and it's really hard because it's really hard. There's no easy thing. It's just how hard it's going to be. And I think in a very sterilized environment, we all have our protocols. We do this this, hopefully it gets better. But what if they can't do that? So I agree with what Doreen said. Sometimes there's a part of grieving, of asking people, okay, what do you think is acceptable to you? What do you think you want to achieve over what time? We can work with that, and we think that it's going to need, and practically, if you want to do this, how long do we think it's going to take more? I think even doctors and community services are a lot more aware of this. They activate community help a lot more. There are more options, which we're really happy about, that people, services going to homes, which wasn't there maybe not so much 10, 20 years ago. I think that's really important because it's a continuum of care and people are having a lot longer support. So people like Doreen are so essential, because there's patients in
every one of us is essential.
For sure.
So much. Acute help. Wow, you have stroke, go hospital, get safe. It's not really like that. It's the lonely months after that I always tell my patient, it's like a marathon. It's not you don't see the 60-meter end mark. It's like a marathon. You it's going to end at some point. It's going to get better. You need to believe in it. And then having people in acute, to people like Doreen who does home service, to families, supporting the family, and long-term care where there is really good options now, with day rehab center, even for making sure people are heard, making sure that the therapies don't stop just because they're not staying with us. I think that's really, really important actually. It's very lonely home when in the hospital everything is planned and done. Then you go home and suddenly it's your own home, Nobody come and kacau you at 10:30. Hey, get out of bed. It's
Nobody kacau them.
Nobody's going to net you. And it makes a difference sometimes. So I always tell my patient, you don't want to do it, you go home with me.
So I mean, it's definitely important, and I completely agree with Yijun that it's not just about the therapists who are in the acute setting, but all the healthcare workers, the entire ecosystem that is out there that runs from healthcare to social services to community services. And so we've got another question that's coming up here, and it kind of runs in the same vein as what Yijun was talking about, in terms of, so how would you motivate certain patients if, let's say, they are there, either at home or in the hospital, but they don't really want to participate in any of the therapy sessions? Like, how would you motivate? Doreen, maybe you'd like to take this one first.
This is a very challenging question because every individual is different. So I will say that you want to motivate someone, the most important thing is like build rapport. So and really find some things which is meaningful to them. So but if really come with a strategy, it's very difficult because usually I will tell the family member, let me just do the assessment first, then I will tell you, so what are the strategies that you can use. But definitely activities engagement is very important. Like for example, I have seen a client, so actually then the family member message me, like say the patient say like want to commit suicide, so during the next session when you come, actually then can you try to talk to him? So then actually then when I see the patients, okay, so I will request. So if I think that patient, sometimes patient probably it's like not willing to talk. It's like because they already very sad. Yeah. So initially they are very independent, but now suddenly there's a role change. So it's very difficult for them to actually tell the family member how they feel. Yeah. So maybe I will request the family member actually, to just like leave the session for a while. Yeah. So the patient told me that actually like he feel very useless. Very simple thing. Brush teeth, he cannot do. Put on the clothes, go toilet, he cannot do. Because I sometimes I really like didn't really expect that actually these are the things which is like so normal to us. Every day we can do. So we never really expect like it's like, actually it's like such a meaningful things to them. Yeah, so after that, and then, okay, so I asked a family member come out, then we say, how if, okay, so we have a session, okay, like, come, let us do this. So when the patients can do, so I think the family member also more confident. Then they say, oh, so actually he can do. Then I say, yes. So maybe it's I try to let them engage in more meaningful things. Yeah, so I think this is what motivates them. Yeah.
So what your strategy sounds like you find out what is meaningful to the person,
Yes.
and then use that to kind of motivate them.
Yes.
And the baseline is rapport. Yes.
Activity engagement. Yeah.
Okay. Then does Yijun have any other like special method, secret method?
So what I don't tell everybody. I bribe them with food sometimes.
What are you doing?
Because they take time, right? Actually, I think it's a very difficult question, and I think it's very hard because it's a new norm. So I always tell my patient, if you compare it to before, it's going to be very difficult. Of course, but if we're here today, let's look at what we are looking towards. And I'm not saying this because it's easy to say. I'm saying this because this is what has always been. When something bad happens, it throws everybody off. You can't do things you used to do, and there's a lot of loss. And sometimes nobody knows where the potential for recovery is, or whether there's any potential for recovery, and that's the truth. And people don't like it when we lie to them. So I've never lied to a patient and said, okay, let's try this for 2 weeks, maybe it gets better. I always tell them, we're going to try this very hard for 1 week. Let's say where we are from experience, where we think this might be able to go. We always, facts are facts. So I always tell my patients the truth. And I said, but if this is day 1, where do we want to be on day 10? And the potential from 0 to 10 is great, usually, right? And then once they've gone past day 10, for example, if they're still with us, they are starting to accept that, okay, this is 10 days, right? And then if they take day 10 to day 20, and we move on like this. I feel that when patients are unwell, the walking with them through that time becomes really important. Versus, okay, at end of 2 months, we're going to be walking independently to going grocery shopping. Of course, that's what we want, right? But I think when everybody is very lost at the beginning, having very simple but very reachable goals are very, very important, because then it becomes something they can do on that day. They're not constantly thinking about what I can't do anymore. It becomes very viable, meaningful tasks. So like what Doreen said is what's important to them. Patients, everybody wants to be independent, right? It's really very, very difficult not to be able to call for help. It's really very difficult. One of the hardest thing that the point of therapy, patient trust, is always when they ask you, 怎么办? What's going to happen from here? What's going to happen to me? And we are talking to people who are way older than me. They could be in their 50s, they could have been in their 70s, 80s. They could be really young, in their 20s with really bad cancer. But they all want the truth, People are a lot more resilient than we are. And when people grieve or people can't take it we can say, some people have stronger character, they pick themselves up really fast, but that's a bonus more than anything else sometimes, If we take it at a fundamental level, I feel that as a therapist, when patients appreciate that, let's just walk through this period and see where we go, because that's the truth. Nobody really knows. Let's go. And that journey of walking through every day, it's very true. So it's not a cliche, take each day as it comes, but it becomes a very practical and very real thing. We're not comparing to 1 week ago. Let's sit out today. Let's try not to have a heart attack today. Let's try not to gain too much today. I always tell my patient, Auntie, 开眼睛, open your eyes. Don't. Let's try Yeah, or let's just
Yeah.
sit a little bit longer. We watch a movie, it's 2 hours. Patients sit out 10 minutes and they're panting because they're so tired, they're so unwell. And then you just say, okay, we hit 10 minutes, or we stand up and we count 30, then some of my patients are very old and then they like old songs. And we say, okay, our goal today is just to sit for one song, 一首歌. I'll play on YouTube, Hokkien Gua, and then auntie, just one song, and that's a goal. And when you have a stroke or something and it's a goal. It might not be meaningful the entire world, but right now, let's just try to do that. And I feel that's pacing them because nobody have to think of that. And that's the role of a therapist because nobody else does that with them, right? Let's pace you to new goals. And how do these goals translate to getting you home and getting you back a little bit stronger?
Yeah, that's so true and so real, I think. And I really appreciate what you say about, celebrating actually the little milestones, even if it's, counting to 30, even if it's, for one song. I feel like, we always try and celebrate the small goals and the small wins so that it makes it easier maybe for the next day and the next session. Yeah, great. So actually I wanted to ask because we've actually been, on and off, the two of you have actually been alluding to, sometimes you do work with people with aphasia. So and it does get quite challenging, I must imagine. So maybe you would like to share a little bit about what is your most memorable experience working with a person with aphasia. Either one can. Doreen, you want to take this one?
Okay. Actually, I did a lot of memorable one. Okay.
Oh,
I think maybe I will just share one or two. Okay. So
Sure.
I think the one I don't know. Okay, so the one of it actually is like this one actually seeing the hospital. This one I think is like forever. We also can't forget. Because it's like really a very successful case. Okay, so this patient actually start in hospital for very long. Physically actually already improved until very, very good, independent, walking around in the ward. The really is like the most important issue is the expressive aphasia, and it's quite bad. Yeah, so I mean, it's like after that improve until simple can. So, but the receptive actually is quite well, quite good. Yeah, so he start in the hospital is because we don't know discharge him to where, because he has a work, he has a job. Yeah, so and the employer actually provides him accommodation. So if he cannot return to work, means he don't have a place to stay. So
no.
yes, so I think that, but we cannot let him stay in the hospital also forever, and he really can work one. He's very independent. So I think me and my colleague, then we really have been, I think, discuss like also with ST and then with physio, see how we can come up with a plan. Yeah, so luckily the employer is very, very supportive. So we actually spoke to him, and the ST then helped to explain to him what is aphasia. Yeah, so it's very important that to work as a team. Yeah, so then that's why we ask about the job analysis, like because his job is like you also need to serve customer. So the employer very supportive, actually willing to let him try. Maybe it's like how about in the kitchen. Yeah, so we really arrange. Actually, usually we do home assessment, but this one is very, very special. We have to do a job site assessment. Yeah, so we actually went to the workplace. So actually it's a food court. And the client's so happy because it's like he has been in hospital for so long. But he has been so happy that after get out for the taxi, he just, went around, walk around to buy a cup of coffee and then want to look for his friend. But we have been trying to search for him. Yeah. Yeah. So after that, then we talk to the employer, his colleague. Yeah, so we do actually visit the kitchen. So we do some, environment assessment, job analysis. So we let the patient actually really try the task and let the boss actually see. Yeah, so and also before we actually went for job site assessment, we also actually spoke to the speech therapist. Yeah, so the speech therapist actually also share with us. So it's like how actually the patient can communicate with his boss and also with his colleagues. Yeah, so after that, I think after about 2 times of the job site assessment, yeah, so after that, then we provide the report to the boss. Yeah, so and the boss actually also feel quite confident because we also make sure we continue to be there to give support. If patient discharge still have anything, I mean, definitely still can call us. Yeah, so it's very
Oh,
successful case. So this patient actually managed to return to work. Yeah, so because
wow, so
after he
wonderful.
discharged, returned to work for about 2 months, he came back and then I just met him, at the lift. I said, hey, you, his expressive aphasia still quite bad. He said, hi, hi, hi. But then he can understand. So I asked him, are you
Yes.
still working there? Yeah, yeah.
Oh,
So this one is really very
fantastic.
memorable. Yeah,
Wow. Hey, that's such a happy, like, happy ending story.
yeah.
Fantastic.
But definitely also thank you, ST, and thank you, Physio. Because it really is a teamwork and a social worker. So yeah.
Yeah. Okay.
Okay. Maybe
Nice. And
this is my
yeah,
case. Yeah.
yay, awesome.
Mm.
And what about for Yijun? You have any like memorable experiences?
Mine's the opposite. Mine's a sad ending.
Oh,
Um,
oh no.
but I guess I guess uh, the memorable one that was hard was a mom.
Mm,
She's my age, so it's always difficult when
yes.
I feel because she's similar
Mm,
to me. So
mm,
we both have very noisy children. We both really dislike housework and ironing. Um, and she came to me as a cancer patient a long while ago, and she had relapsed and it went to her brain. So when the
mm,
OT and I saw her during her last admission, it was really difficult because she was losing strength.
Mm.
She lost her ability to speak very, very quickly, and she was very tired because of the cancer. Her son was very young at the time, same age as my oldest, so she was 5. So it was very difficult. It was a very difficult time for her, and and there's no good news. Every day is just bad news all the way.
mm,
So if your question of what do we do for patients who have no happy ending, I mean, all of us will pass on at some point. It's just how we
mm,
go, right? So very mature conversations and very honest conversations about what's important to you. We don't even know how much time she had because the cancer was so aggressive.
mm,
And it was incredibly difficult because she couldn't speak towards the end. She was really tired, but she also had so much problem finding words for what she wanted to say. And initially, she could write a little bit, but it was just tiring. So on all grounds, it was really difficult. And so she started not to speak. She started to just shake head and not, and she was angry. And that was the main thing we felt that she needed a lot of support on. So the OT and I will, and the ST as well, we would plan therapy. Like it was remarkable because it was really a lot of people's effort. Like we tried to empty the gym when there was no patient so that she could sit in a wheelchair and she could just have a quiet space just to try to do something. It could be coloring, it could be something to engage her because she was in the hospital all the way. And getting her to, because there was so much to deal with, getting her to try to say what was important to her, because there was a time factor to it too. And she always wanted to resolve issues that she had, to leave things for her son, to be able to say things to her husband. So Aphasia really messed it up because she had
yeah.
so much problem on top of that, and there was so much grieving and so much loss. And so if you ask me what's the best thing that we could do for patients, really is time.
Mm,
Like
mm.
we'll go in when there was no therapy, we would sit with her. I would buy her food. uh, like, you don't want to eat. I think time is a great thing. I think in the world that is really honestly so fast in everywhere, even in healthcare, where you're shortening length of stay, and it's so rare. And in my life, if there's one thing that I've learned that I appreciated in my work is to really pause and tell patient I have time. I might be super busy because if they know me, they'll see me rushing. I have time.
Yes.
You know what I say? I will wait for you. And
Mm,
and I will text my boss, my friends at work, and I'll say, my gosh, so and so just cried today. Because sometimes they just needed somebody to talk to them. And if you cannot speak properly or you cannot express your thought, the challenges to having your voice heard is even harder, even if it's with therapists or with family or with anybody. And it's already a difficult journey to be ill, which is why I feel the ability to pause and talk to people and give them that space makes the journey a little bit just so much easier, so that even at points where they don't wish to talk, they know that somebody is going to wait for them. And it's always humbling. I mean, I'm old, but I'm not that old. It's humbling when people in their 60s or 70s, when they've gone through so much in their life, you look at their medical history, it's like a storybook, they've operated on everything, they've tried every drug. And they tell you, honestly, like, they tell me things like, how am I going to go home? How am I going to live my life from here? And these are people who are so wise in their years. And they ask me. And the honest truth is, I don't know. And they know I don't know, but they want somebody to talk to them about it. So I feel that the most important thing sometimes that we give to patients is that the time, that if you tell me what you need, maybe we can sort something out, the OT might get you something, the social worker could plan somebody to visit you, we could give your family some support, because it's just not the patient, right? Sometimes the family that's so overwhelmed, the wife hasn't worked, there's 4 young children, the husband is sick. These are really real problems. So if there's one thing I would like people to know is that there are people who genuinely want to help, and there are resources available. Maybe not so obvious to a lot of us, but let it be known. Don't not talk about it and think that it's okay, I will handle it. You can, but you don't have to. That's what I always tell my patient. Life is hard enough. If there are things we can help you with it, well, if we cannot, we will tell you. But don't keep quiet, not say anything. So for that patient, I mean, she passed away within 3 months, and in the end, all she could express herself, because it's about expressing yourself. At the end, all she could do was grab our hands or hold our hand, but she would always pat my hand, and I would cry like mad and because she'll pat my hand and but she's too tired to talk. But to me, that's the role that they've gone through this part, and they're not alone. It's a very difficult thing to be alone. I mean, even for us, I feel, even though for us as healthcare professionals, we see so clearly the trajectory. Sometimes we are so good at it, we eyeball that person, we know how long they're going to survive, what outcome is. It's so clear because it's a cerebral, it's a head knowledge, right? But you translate into holding your patient's hands, they're going to go home for maybe 2 weeks and they're going to come back, and the next time they might not survive it. That's the real thing about healthcare, I feel. It's not glamorous. It's not like Korean drama show. Everybody wake up after a coma. My gosh. And then they tell you what's happening. I said, that's a drama show, But it doesn't mean that because we cannot have what we think should be the outcome, that the journey should be lonely, or it should be something that is we try to avoid it, because the truth is we can't avoid it sometimes. And I think that's important. So for memorable patients, it's always when my patients start crying, at one point you feel happy that they trust you enough, or they feel safe enough to say, I cannot. It breaks my heart when my patients say, physio, today I cannot. And then I cannot, and I feel like, okay, but you feel sad because it comes to a point where we're not going to be able to do very much anymore because they're that ill. But that's also the thing that I'm glad you're telling me that this is what you want to do today. You want to rest today. I respect that. I can honor that. So you ask me who's memorable, the ones that cry. I always remember the ones that cry.
But I guess what I'm taking away from the sharing is not just about the crying. I mean, communication actually takes many forms, and it's not just about what is said, but I guess like what you say as well, what is unsaid, and like a touch is actually really important. Having that physical touch, which I feel now, with COVID-19 and all the infection control things with gloves, I just feel like it's not the same. But yeah, so even with like touch, or even with like a look, sometimes that's really, really important and very, very precious between human beings. Don't even talk about therapist and patient, but like between human beings, and that might be the thing that the person kind of holds dear to them. So yeah, sorry, I'm also a bit of a crier. So when you were telling your story, I was like, oh no, that's really sad. Okay, so anyway, we're actually approaching quite close to the end of the show.
Okay.
So I just give you a little quick, I just wanted to share with everybody that actually both Yijun and Doreen have been very, very active volunteers with Aphasia SG, and I just wanted to show how all the things that they've been doing. So this is Yijun doing sessions with our participants, and if you see if you just watch this clip, it's like everybody is yeah, everybody is just like, and she's like whipping everybody in shape during as they're at home. Yeah, and also like Doreen is actually and so both of y'all have been like active volunteers with like Aphasia SG and Chit Chat Cafe. So maybe I just get each of you to share really quickly why Aphasia SG, what kind of draws you to it, maybe because you all both are very busy. Yeah. Okay, Doreen, why don't you share? You look super
Okay.
happy in these photos.
I really miss that. Actually, everyone we actually quite happy, very happy. I would say very very happy. Okay, so at the beginning, actually, it's Evelyn shared about Chit Chat Cafe with me and my friend. If you can see the picture, actually the guy standing behind me, he was my friend actually who has traumatic brain injury. Yeah, so actually
Okay.
chance actually led him to be volunteer there. Yeah, so and then it's really meaningful. Yeah, and I think it's really important. Even though during the group, probably is a lot of them actually have quite severe aphasia. Yeah, so they can't really express, but everybody just laugh. We really enjoy the games actually planned by all of you. Yeah, so it's really fun and meaningful. Yeah,
Yeah,
so I mean,
awesome.
because now we cannot keep the gathering like that, right?
Yes, we cannot. We would be breaking the law.
Mm.
And what about Yijun? Yijun, you're so busy. What draws you to Aphasia SG and like volunteering for Chit Chat Cafe?
So I volunteered because the ST in my hospital told me about it.
Yeah.
I think it's a very honest organization that honestly just wants to help people and be support. And I think that's really good. Like the fact that it's so many volunteers means there is nothing in for anybody except that we genuinely believe that the heart is there in this organization. And I see it. It's not just a short-term thing. I see people investing their time
Yeah.
because people should have support. And it's great that in our small, really very small capacity that we can be there for people a little bit. Yeah.
Yeah.
But I
Oh,
think I do
thanks
believe
very much,
yeah.
guys. Oh wow, we have this one question asking when will we start Chit Chat Cafe again?
Ask
We don't
government.
know, guys. When we're not breaking the law, we will definitely start Chit Chat Cafe again. Um, but I guess in that, I'm gonna do like a little spiel on, if you'd like to sign up as a volunteer for with Aphasia SG, you can take a photo of the QR code and it will lead you to a form that you can fill in to indicate your interest. And as soon as we are legal, in terms of gatherings, we will, get Chit Chat Cafe physically back again. So definitely watch this space. And so yeah, I guess we have actually come to the end of the show. Just give me one moment. Yeah, so we've actually come to the end of the show today. Thank you so much to both Yijun and Doreen for being with us, sharing your thoughts, having a lot of laughter, and also like one or two tears from myself. And I think all our viewers have definitely learned a lot more about what occupational therapists as well as physiotherapists do. So as a leaving note, I just want to remind everybody that we're back next week. And the session next week, or the episode next week, is actually going to be featuring our youth volunteers. So it's going to feature Chinwei, Marcus, and Esther. And they're our youth volunteers that have been, volunteering with us very, very actively with Aphasia SG and Chit Chat Cafe. So, if you guys are free next Thursday, 8:30, same spot, we'll see you here. All right. So thanks once again to Doreen and Yijun for spending your Thursday evening with us. Thank you.
Everyone.
Bye bye.